Today is a Medicare presentation about all parts of Medicare as well as the changes for 2026. Um, so, I am the owner and operator of Senior Shield Health Insurance, which is my insurance practice where I am the one and only entrepreneur. So, we are going to get started. If there's anything you can't see or you want me to stop and pause, let me know. But this is a long presentation. It's going to be about an hour, okay? So just keep that in mind, okay? All right, Jerry, you ready? Okay, next slide. So we're going to start off with the basics. Who's Medicare for? It's for people over the age of 65. If you are working and you're still over 65, the Part B is optional. And you'll also find people on Medicare who have been on Social Security disability benefits for over 24 months, even if they're under the age of 65. And then anyone diagnosed with Lou Gehrig's autism also will get Medicare automatically. Next. So there's many parts of Medicare, which makes it very confusing. Today we're going to go over parts A, B, I'm going to put C in quotation marks, C, as well as D. We're going to talk about different enrollment situations and lots of different price changes for 2026. Next. So we're going to start with Part A. So if you see on your worksheet, there's a section for Part A. Okay, next. So the biggest thing to realize about Part A is as long as you've worked, you or your spouse, for 10 years, Part A is going to be $0 for you, okay? It does have a deductible, and this is not an annual deductible, it's a repeating deductible. And that deductible amount in 2025 was $1,676, but it's going to go up to $1,716 for 2026. It's a rolling. So now that you know what the numbers are, the deductible starts over every 60 days. 60 days. So you could hit that number 6 times in 1 year. Oh, indeed. Okay? So that's important to understand, Part A. Even though it's no monthly premium, it does have a rolling deductible. Okay? What does it cover? Inpatient hospital care. This is once you've been admitted, not an ER visit, okay? Hospice, as well as short-term skilled rehab. Now, sometimes you will get short-term skilled rehab in a nursing home, but, next slide, Medicare does not pay for nursing home. So when Dorothy was talking about sending her mom off to Shady Pines, she was not paying for that with Medicare, okay? She was paying for that out of her pocket, okay? That's very confusing because people think that nursing home is covered by Medicare and it is not, okay? All right, next slide. Okay, so that's Part A. We're going to move over to Part B, okay? Next. Part B does cost you every month. It usually comes out of your Social Security check, and it is increasing for 2026 by $21.50. So it'll be $206.50 for most people, okay? It also has an annual deductible, so this is just a one-time thing, okay? It also is going up by $31 to $288 for 2026. That was a long time ago. Okay, next slide. Now you're probably thinking with all these increases, this is going to get costly. One of the things that they try to do is put rules in place where the Part B increase is not greater than the cost of living increase you get on your Social Security benefits, also known as the COLA, the cost of living amount, okay? So last year, the increase was 2.7%. This year, it's going to be 2.8%, okay? So it is going up, but there's also costs going up. Next slide. Oh, and you get that information in your Social Security check. That number is an estimate. They will tell you in December what that amount will be, or what that percentage will be in the cost of living increase, okay? All right, so what does B cover? B covers everything after you are discharged from the hospital and before you step foot into the pharmacy, okay? So it will cover ER visits, doctor visits, labs, x-rays, ambulance rides to the hospital, durable medical equipment, any mental health issues and stays you may have, as well as detections, early screenings. This includes mammograms, colonoscopies, anything where we can detect it early or treat it better, Medicare will cover, okay? Next slide. What does Medicare B not cover? This is important. It does not cover hearing aids. It does not cover dentures. It does not cover dental implants. It does not cover glasses, nor cosmetic surgeries, fillers, facelifts, BBLs. Okay? It don't cover any of that. All right, next slide. So you're probably thinking, if you haven't already signed up for Medicare, or if you have a family member who's going to sign up soon, where do we go? Well, the best place to go is the Social Security website. That's the fastest way to sign up. If you don't like to do that, you can go to the building. It's on Green River Road, the Social Security building, okay? Historically, they've always said, before you sign up for A or B, give us 3 months, and we'll make an appointment for you, and we'll book you, and everything will be fine. Well, they've been doged, right? So now it's 4 months, and they strongly encourage you to go to the website. Okay? So if you have a family member, or if you know you need help, have somebody with you as you go to that Social Security website as you enroll. Okay? Now, Part A usually happens automatically when you're 65, but if you're still working, it will not automatically sign you up for B. You have to actively go and sign up for B. Okay? Next slide. Oh, yes, ma'am. Miss Birdie's question was, if I'm still working, can I keep my health insurance or do I have to drop it? Is that what your question kind of is?
There's different parts to it, yeah.
Okay, so that's a very good question. The answer is you don't have to sign up for B. You can keep your benefits from your employer with your health insurance, okay? You can even sign up for the drug plan and not take your job's drug plan if it comes separate, okay? That's an option. You will automatically get A. You don't have to sign up for B. You can keep your employer's. Okay, so if the premium, if you find out the premium's cheaper, you can go with whatever plan works best for you, okay? Yep, the timing is everything, so the last slide in this presentation is for you, okay? All right, very, very good question. Because, again, with Medicare, timing is everything, okay? All right, so, again, Part A is usually automatic when you're 65. Part B, you actually have to go somewhere to enroll, whether you're still working and you want to get it anyway, in addition to your employer's insurance, which I wouldn't pay for both. Choose one, stick with it. Or if you decide at the time of retirement at maybe 70, you would still need to go to one of these websites, the website or the building, to sign up for B at that time, okay? Next slide. So, in my personal opinion, I would strongly encourage anyone I know, to not go to a captive agent that can only sell you plans from their company. So what I'm saying is, don't walk into the building that's got the green on it. Don't walk into the building with purple. Go to an agent that can sell you both of those colors if it's best for you, okay? One of the other important things to remember is this agent or this broker cannot sign you up for your supplement or your Part C or your Part D until you get the A and the B. So you got to do the Social Security part first, then go to them for those other parts. And it's very important that they don't charge you anything for their consultation or for their quotes. There should be no cost to you. If you decide to enroll with them, the insurance company will send them a check, okay? They should not be charging you for any of these services, okay? If they do, you let me know. Okay, next slide. All right, so we've talked about A, we've talked about B. It is a government-provided health service. It is an 80-20 plan. Sounds pretty good, right? The problem with Original Medicare, having it alone by itself, is that there is no ceiling to that 20%. And with healthcare costs rising, it is very easy to have a open heart surgery that will cost you $1 million, and then you're owed $200,000. No good, right? So that 80, that should be the big part of the pie, feels like 20 to us, okay? So it should be flipped. But with just A and B Medicare only, it's not enough. We need something that's going to help cover that 20% to help us so we don't have to go bankrupt even though we're on Original Medicare because we had an expensive procedure, okay? So that's where the other parts of Medicare come in. Next slide. So, do we want Original Medicare by itself? No, we do not, okay? Next slide. This is why there are supplements, Advantage plans, Part Cs, Part D plans. This will help cover this gap because without this coverage, your money will be stacking to the ceiling of this building or higher with how much you could pay in that 20%. We need something that's going to give us a ceiling that's lower, or give us a ceiling at all, okay? All right, so we need something that's going to cover this 20% gap. So, next slide. That is why we have these two options, supplements or Medicare Advantage, okay? I want everybody to turn to the part of their handout where it's got my little face at the bottom. This is showing you at the top, you've got Medicare A, you've got Medicare B, but then at the bottom you've got two options. One is the supplement on the left, one is the Advantage plan on the right, okay? We're gonna go through both options because for some people, you wanna choose one, for other people, you wanna choose the other based on your health, based on your finances, but you need to make that decision because it's not easy to hop and switch back and forth, okay? Next slide. Okay, so you're gonna see this slide several times. It's gonna be kind of our guide. It is gonna, hold on, I'm thirsty, pardon me. Okay, so we've talked about Original Medicare. We've got Part A check, we've got Part B check. Next, we're gonna go to Advantage plans. Advantage plans have A, B, and the drug plan all together, okay? Next slide. So, all the part that I'm talking about for the rest of the presentation is brought to you by insurance companies. I'm not gonna mention any of their names because they're not paying me to be here. This is just something I'm doing out of the love of my heart because this is a very tough topic and I want you all to learn these pieces, not just for yourself, but for your friends and for your family, okay? So they are not sponsoring this seminar, so I will not say any of their names at all. Next slide. So here we are. We are going to merge onto this private road and talk about Medicare Advantage plans. Okay? Next. Okay, this is really small, but one of the things that's important on this to see is the bottom is the hospital, the next is the medical, then you have the gap coverage, which is at 20%, then we have prescriptions, that's a little tablet, and then we've got eyeglasses. That's called healthy extras. As you can see, Advantage plans, which is the far column on the right, has all of these checked. Okay? Next slide. So let's talk about these healthy extras. Okay? This is what you see on the commercials being advertised starting probably soon until February. They're going to talk about, oh, I got some glasses and I got a hearing aid. They're going to be talking about all these healthy extras, okay? So in 2020, which is where this little clip came from, those are all the different extras that were included in some of the plans. Plans can choose to offer some and not others, and how much they want to offer, okay? So we got eyeglasses, telehealth, dental health, fitness benefit, hearing aids, over-the-counter benefits, meal benefits, transportation, bathroom, safety, and in-home support. What you will see in 2026 is that these extra healthy benefits are going to be decreasing and maybe even disappearing, okay? It was big into 2020, but it's going smaller if not going away, okay? Next slide. So Advantage plans, I call these pay-as-you-go or a la carte, okay? If you go to the health system a lot, you're gonna pay a lot. If you don't go as often, you won't pay as much, okay? So healthy, accident-free people pay very little and they never meet their maximum out-of-pocket limit, or the MOOP. We're gonna go into that in more detail next slide. But if you're pretty unhealthy, or if you've had a lot of accidents or a lot of health issues, you probably reach your maximum out-of-pocket limit every year very fast. So it's just something you need to know about, and it changes every year. Next slide. So what is the maximum out-of-pocket limit? It is that ceiling that we are wanting that original Medicare does not give us, okay? So this is a ceiling. After you've spent this amount that's been determined by the insurance company, we don't get to decide the MOOP. They decide it for us. Once we've reached this amount, we don't have to pay anything else for the rest of the year. If you guys could come forward, you'll be able to see better. Come on, please. Okay, so in 2025, I'm sorry, the maximum out-of-pocket maximum for in-network services was $9,350. But for 2026, that amount is actually decreasing, okay? So it's the other way. So now it's $9,250. Now, insurance companies don't have to make that their max. They can make it lower, but that is the maximum amount they can choose to offer, okay? And again, this is for in-network only services, okay? Let's go to the next slide. So let's talk about best case scenario, worst case scenario with an Advantage plan. Best case scenario, you go to your doctor once, your primary care, you pay the copay. You go see maybe one specialist, you pay the copay and you get your labs done. You don't go, you don't put as much money into that pot, okay? Now, worst case scenario, you have a hospital stay, outpatient procedure, you're in rehab for more than 20 days, you get a X-ray, labs, MRIs, and CAT scan. You're gonna be putting a lot of money in that bucket, okay? So you probably are gonna reach your maximum out-of-pocket limit as opposed to the healthy situation. But we don't know what the future holds. right? So we need to be prepared for both situations. Next slide. So one of the things that's important to realize with Medicare Advantage plans, they are broken down to either HMOs or PPOs. Most of us memorize what the difference is, but just to help you, I kind of came up with my own little abbreviation. So for HMOs, you're in a yard and it's got a brick boundary. Here are my options, HMO. You can't go out of network, you can't go over the fence, you can't go under the fence, you are just here. You cannot go outside. For that, you usually are paying a lot less for your services, okay? You have a primary care physician and you have to ask for referrals, okay? With a PPO, on the other hand, that's kind of like a chain link fence. You can kind of step over it, come back, go over, come back. I abbreviate that and I say when it comes to providers, you're pretty open. PPO, providers pretty open. These are my abbreviations, so you can take them or leave them. But you can go out of network if you like. You don't need to have a primary care physician and you don't have to have any permission to get a referral, okay? So you have that freedom. But for that freedom, it does cost you a little bit more for those plans, okay? So we got HMOs and PPOs when it comes to Advantage plans, okay? Next slide. So let's talk about Medicare C. I say C because it's confusing, okay? Because I put both C and supplements together because they're both giving you that ceiling. But let's just talk about the Advantage plans for right now. It's pay as you go, and most of the time, your monthly premium is zero, okay? They advertise that a lot on the commercials. No monthly premium, okay? Next slide. They also have regional networks, so you have a PPO or HMO. The drug plan is built into the plan, and it includes basic vision, dental, and hearing, and possibly a fitness program, okay? Now, I say basic, but I also want to remind you, those services are dwindling or may possibly be going away, but we don't know exactly for each plan yet, okay? So that's Advantage plans. Next slide. There are ways that members can rank plans when they've been in them. This is called the star ratings. So whenever you're looking at re-enrolling or enrolling into a new plan, you need to look at these stars. 3 is average, 4 is above average, and 5 is excellent. If there are no stars, that means that plan is very, very new, or there's just not enough members that have provided the customer feedback survey, so it's just not enough data, okay? There was some plans in Evansville that were no stars, but they have been around long enough, they have very, very good stars, and so we're in a good area that has, most plans have 3 stars or above, okay? Next slide. Now, this is a scenario, a situation, it's not very popular, and you probably have never heard about it, but I wanted to make sure I threw it out there, so if you're interested, you can dig more about it, or ask around, and it's called Medicare Medical Savings Accounts. So this is where you sign up with an insurance company that offers these. It gives you money to put into account. It gives you money into an account, but you're not allowed to add money to that account. But you can use that money in the account for health care services, okay? You can use it for dental, hearing, vision, but there's a high deductible for these plans. And sometimes some of the things that you can spend your health care expenses on don't go towards the deductible. So if you decide to get a dental implant with your medical savings account through Medicare, that part actually doesn't go towards your deductible, but it helped pay for it. So really, you know, who cares, right? But it's not very popular, not a lot of people like it, but it's out there. So I wanted to make sure you guys knew about it if you were interested, okay? All right, next slide. Okay, the one good thing about Medicare Advantage plans is they do not require health screenings at any time, ever. So no matter what your Oh, Lord, help me out. What's that called? Pre-existing conditions. Thank you. No matter what pre-existing conditions you have, you can always get an Advantage plan. Okay? All right, next slide. All right, so we talked about A, we talked about B, we talked about Advantage plans. Next, we're going to go to supplements, also called Medigap plans. Okay? Next slide. So supplements, unfortunately, they're also lettered, which was very dumb. It's more confusing. But all you need to know is the best plan is a G plan as of right now. That's all I sell. If you're going to play around with the other letters, you might as well get an Advantage plan. So what does G cover? Next slide. This is a chart. You'll see this. All you need to know is in the G column, there's one little box missing that doesn't have a check or something filled in. And that box is the annual Part B deductible. Okay? Now, I already told you the deductible is increasing from $185 to $257. So that is what you'll be responsible for with that plan, in addition to the monthly premiums. After that, you don't pay anything. Okay? Supplement premiums vary per age and per gender and per company. And there used to be a C and an F plan, but that's really not available to anybody who turned 65 after 2020. But there are a few people around who are just now retiring who are eligible for Fs and Cs. So those people can be grandfathered in, but for most newer folks, you can't get an F or a C. The best plan is a G. Okay? All right, next slide. All right. The wonderful thing that people love about supplements or Medigap plans, that there is absolutely no network. If you want to go to California for your cataracts, you can. If you want to jump all the way to Nevada for your knees, you can do that. You can go anywhere, no referrals needed. As long as they take Medicare, they can see you. And most providers will see you for Medicare. What they don't always take is Medicaid, okay? So you can go anywhere in the continental, well, I don't even know if that's the right phrase. You can go to Alaska, Hawaii. You can go anywhere in the United States. There we go. Okay, next slide. So what does Plan G cover? The Part A and Part B co-insurances and deductibles. Remember that rolling deductible we had with A? It covers that. It covers all the Part B excess charges, which are just excess charges. You ain't got to pay for that. They even actually help cover foreign travel if you want to travel outside of the country. Okay? Now, they're not going to put you in a spa. They'll fix you enough to send you home. Okay? Okay. And then while I'm on this subject of travel, I forgot to mention, for Advantage plans, even if you have an HMO or a PPO, don't feel like you can't travel with an Advantage plan just because your doctors and everything are in this network in Evansville. You can still travel. If an emergency happens to you and you have an Advantage plan and you have to go to the hospital, they will treat that hospital. As long as you come in through the ER and they've admitted you, they will treat that hospital if you have an HMO as in network. So don't feel like you can't, go to Vegas or Alaska and just because you have a HMO in Evansville, okay? I forgot to mention that. Okay, next slide. Next. Uh-oh. Okay, so here's that same slide we were talking about, Medicare Part C, even though Advantage plans are the only Cs, supplements aren't really Cs, but anything that gives you that coverage of protecting you from that 20%, I just call it a C, okay? So, supplements, Medigaps. You are actually prepaying for all of your potential health care needs every month with the monthly supplement premium. So even if you don't go to the doctor at all for the whole year, you're still paying that premium, okay? Monthly premiums start around $100 or so, and they go up as you age every year, okay? So we have some blessed 90-year-olds who have a $300 a month premium on their supplement. But they don't want to get rid of it because it's been good to them so far, and they haven't had to pay a dime forever since they've been on Medicare. So it's a pros and cons, right? Okay, next slide. Again, supplements have a nationwide network. You do have to buy your drug plan separately, okay? So you need to put that down on your supplement section. Oh, I forgot to tell you, we're on the supplement section of your notes. So you have to buy your drug plan separately. It's not built in like an Advantage plan. And then if you want vision and dental and hearing and a gym membership, you have to pay for that, okay? So not only are you paying for the supplement monthly premium, you're paying for a vision dental plan, you're paying for your gym membership, you're paying for your drug plan. So supplements can be kind of pricey, okay? Next slide. So people always ask me, can I have both? The answer is no. You gotta make that decision, okay? So what I usually see for people that have supplements, they're preferred by people who are financially secure or choose to make that a financial priority, or they have poor health history or poor health at the moment, or they fret the big bill that could potentially come with an Advantage plan. Because remember, you're not paying every month, but if you have a situation, that bill can be really big, so they don't like that thought. I see people on Advantage plans who are really healthy, or they just have very little expendable monthly income, or they just choose that supplements aren't a big priority to them. They can get everything they need in an Advantage plan. So it's really up to you. There's really not a wrong or a right answer. You have to look at your personal health history, and you have to look at your finances. Okay? Next slide. So one of the things you have to remember is when it comes to supplements, at 65 or when you decide to retire, you get a one-time no health history entry. They cannot deny you at all. They have to accept you at the exceptional rate if you are just turning 65 or if you are just retiring. Okay, so supplements will let you in. After that, if you decide you want to switch to a different plan or you want to go to Advantage plan for a year and then come back later, you will have to answer all of those health questions. And if they don't like what they see, they will tell you, no, you cannot be accepted into this plan. Okay? Now that's very opposite with Advantage plans. They'll take anybody. Remember, no health screening. But supplements, you only get a one-time free entry. And that's right when you retire. So you need to know when that time comes, what do you want to do? Because it's hard to go back into a supplement once you've left one. Okay? All right, next slide. So remember we talked about that 20% gap. How is that gap covered? With supplement plans to figure out your to figure out your annual healthcare spending. All you have to do is multiply your monthly premium times 12 and add your Part B annual deductible. You already know what your annual healthcare spending is going to be on the D plan when it comes to your health. Now you have to add in the little drugs on the side, but for the health part, you already know what it's going to be, so you can budget appropriately. With Advantage plans, you may or you may not hit the maximum out-of-pocket limit. You just don't know, right? And you're paying as you go. So it could be that you've chosen a plan that has a maximum out-of-pocket of $3,000, so that's your worst-case scenario. Or it could be that you chose a plan that has a $10,000 maximum out-of-pocket limit, so that's your worst scenario. So it just depends on what plan you chose as what your ceiling will be. Does that make sense to everybody? So that's why I put them together, but they're really not together. C is an Advantage plan, supplements are just supplements, and then original Medicare is just original Medicare, okay? So remember on the sheet that you have A and B on the top, and we've gone through both sides now. We've gone through the Advantage plan, and we've gone through the other side, the supplement side. Okay? So now, next slide. Okay. So, new things. In 2026 in Indiana, there is a new rule. Now, remember I just told you before you can't switch, it's hard, you have to answer all the health questions? Well, they changed that. I forgot about that. So here is the new rule. The month of your birthday or 2 months after, in 2026, you can apply for a supplement with the same letter. You can switch companies. And they cannot tell you no. So this is key for some people, right? Whereas before we've tried to switch and they had health questions, they said no. Now they will have to, but it's right around your birthday. Only that window. Now, the aim is to save seniors money, short term, but we've seen in Nevada, where this has been around for a long time, it really takes out some of those small insurance players. So in the long term, it's not gonna benefit us, but for right now, this is great. We'll see. They may change things later. Who knows, okay? So this is really gonna be really, really helpful for people who have had health conditions and been trying to switch but weren't unable. Around their birthday in 2026, they can, okay? It's called the birthday rule. All right, next slide. Yes, ma'am. Yes, ma'am. Yes, ma'am. They cannot tell you no as long as you apply within that window. And this is new for 2026. 26. Okay? All right. So we've talked about A, we've talked about B, we've talked about Advantage plans and supplements. Now we're going to go to Part D, the drug plan. Next slide. As your friendly pharmacist, this is my favorite part of Medicare. I'm just gonna be honest. I love it. All right, next slide. Next. All right, this is hard to see. All you need to know is that there are 3 stages of the drug plan, 3 stages: the deductible stage, initial coverage phase, and then catastrophic phase. That's all you need to know from this slide, okay? Next slide, because I'm gonna go over them in detail, okay? Deductible stage. Not every drug plan will have a deductible. Some do, some don't, okay? The initial phase, this is where you and your insurance together are paying for your prescriptions, okay? So that means you have the co-pays or co-insurance, okay? Catastrophic coverage happens, not for everybody, but once you spent $2,100 on your prescriptions, and it starts over December 31st, okay? So not everybody's gonna meet catastrophic coverage. Not everybody has a deductible, nor will everybody meet their deductible, okay? So everybody's asking, well, how much is it? Okay, next slide. So in 2025, the maximum deductible a drug plan could charge you was $590, but that has been changed and increased to $615. Also last year, the maximum out-of-pocket limit for drug plans was $2,000. This year, it's $2,100, okay? So not everybody who's on generic, cheap medication will even meet any of these numbers, okay? But if you're on brand name or anything injected or special medication, there are some people who meet this in February. And then there's some people who never meet it at all, okay? But keep in mind, it starts over every year from January 1st to December 31st, okay? Okay, next slide. So a lot of people don't understand some key words when it comes to Medicare Part D or any prescriptions ideas. So the number one thing is formulary, A lot of people get real excited when they're on Medicare and they come to me in the pharmacy. They were like, I'm on Medicare, everything's covered. That's not the case. There are a list of medications that your insurance company will cover and will not cover. So sometimes your doctor prescribes things that are not on that list. And as your friendly pharmacist, it's my job to switch it to what is on the list, okay? So that sometimes happens. But most of the time it happens behind the scenes and you don't even know anything happened. We try to take care of it before you get there, okay? The second important understanding that you need to focus on is tiers. Tiers are levels of what those lists of medications are and where they're put into. So every drug plan has tiers. Every drug plan has different medications in different tiers, okay? So you need to understand where your medications are and what tier they are, because it's going to tell you what your copay or what your rate's going to be, okay? The higher the tier number, like tier 6, the more you're going to pay. Things on the bottom of the tier are usually either free or very, very affordable, okay? There's also quantity limits. So this is a limit that your insurance has put in place to either save you or save them some money. Save your health or save them some money. So for example, if your doctor says, oh, you can take Norco 12 times a day, your insurance is gonna be like, you're gonna die. We're not paying for 12 a day. It's a safety limit, right? To save you from a crazy doctor who's just prescribing all willy-nilly, right? Or they have a prescription that's very expensive, I'm gonna say Januvia, you can take that 4 times a day. It's expensive. They're not gonna pay for 4 times a day for a month. That's expensive. They're not gonna do that. So they have quantity limits to either save your health or to save them money. So there's a couple ways. One, if you're already on a drug plan, they will mail out to you the annual notice of change form at the end of the year, usually around now, right before open enrollment. And they will tell you what the cost will be for the medications you're currently on and what tier they will be in next year. Or you can go to me and I will tell you at our end of annual year appointment, okay? Because we can type your medications in and look at what plan will be best for you. And then when we look at the plan that's best for you, we can look at what tier that medication is in. Most of the time, you don't even know about the tiers. You just know it's a $5 copay and this one's got a $20 copay. But that tells you right there. One's a tier 1 and one's a tier 4, or whatever the tiers are, okay? So that's just the way that insurance companies will inform you and make decisions about where the cost of medications will be. Does that make sense? Okay. All right, next slide, please. Okay. I know you can't see this, but it is a representation of what I was just talking about. So the pyramid, your medications on the bottom, tier 1, are very, very cheap. You're smiling. But as you step up to tier 6, you're crying tears. Get it? Tears and tears? Because it's so expensive. It's tier 6, okay? So that was just a representation of what we talked about earlier, the different tiers, okay? Next slide. Okay. Last year in 2025, there were 14 different drug plans to choose from. I know. How do you choose? How do you know? First and foremost, you have to know what medications you're on currently and what you anticipate taking and what pharmacy you prefer to go to, okay? Every year, just like insurance health coverage, prescription drug plans change their networks, okay? So whereas CVS was a network this year, it may be Walgreens preferred next year. If you don't know that and you still stick with CVS, you're paying more than you would have if you just switched to Walgreens. As a pharmacist, it don't hurt my feelings. We do it all the time, every day. We don't take it personal. don't take it personal. Just go where it's more affordable for you, okay? You can come wave at me later. Yes, ma'am.
I thought I heard you mention something about if your doctor prescribes a medication for you that is up in a tier 3 or 4, and you bring that prescription to the pharmacy to have it filled, that behind the scenes, you would look at that medication and see if maybe there would be a benefit from using a tier 1 to save you some costs?
Okay. So Ms. Bodzell asked, when your doctor sends in a prescription that's a tier 4 or 5, behind the scenes, will your pharmacy or your pharmacist look to see if there's an option that's on tier 1 or 2 that'll be cheaper for you? What that usually looks like in the pharmacy world is called step therapy. I didn't do this in there, but I'm going to answer your question. So usually insurance companies will either charge you a lot and you're either willing to pay it if you want, or they will offer you that you have to try this medication first. After you fail all of these at step 1, step 2, step 3, then we'll pay for your step 4 at this cost, and it'll be cheaper, potentially, okay? Now, does it tell me all the steps that you have to fail? No. It will just flash on my screen and says, requires step therapy. So that tells me the medication's not paid for as of yet, but your doctor has to do some work to submit what has been tried, what has been failed, what dose, what frequency, and then after they do all that paperwork, then the insurance may decide, okay, we'll pay for it, since you've done all the steps in the step therapy. But what I was mentioning earlier was medications that were not on formulary. So for example, your doctor sends over a prescription for atorvastatin. It's not on your formulary. We'll switch it to rosuvastatin on your behalf. That's formulary switches that I was talking about prior. But step therapy also does happen. That doesn't answer your question, does it? Ask me again. So behind the scene, a lot of things happen at the pharmacy. We can either switch medications that are not in formulary to medications that are in formulary. We have to switch the directions if it's above the quantity limits. So we have to change the direction. So instead of 4 times a day, they'll pay for it if it's 3 times a day. So we'll do that on your behalf. So when you come by to pick it up, it's paid for. And we'll inform the doctor, hey, their insurance wouldn't pay for 4 a day, so we switch it to 3 a day. They say, okay.
Formulary and generic.
Mm-hmm.
You prescribe the medication that is in a tier 3, and there is no generic.
Okay, good question. There we go. Okay, I think that's where I'm getting. Okay, so she asked, what if your doctor prescribes a brand name medication? There is no generic. Insurance companies have to pay for prescriptions in every single drug class, at least 2. If there's only 1 drug in the drug class, they have to pay for it. But the insurance company has to decide, especially when the medication's new and it just comes out, what tier they're going to put it in. Okay? So your copay could be $20. It could be $600. It depends where they're putting that tier of that new medication that has no generic available. Does that answer your question? Okay. Because you're right, there are medications that are brand new that come out where there's no generic. Insurance will have to pay for it. Have you had an opposite situation?
Well, with my choice of a D, so maybe that's why.
Your choice, your prescription drug?
Yeah, the prescription drug plan, maybe I've got the wrong one.
So did you type the medication in and the medication was expensive? Was it covered? That's the question. So whenever you type the medication in, it'll tell you the cash price of what that medication will be. But that doesn't mean that it was covered.
So it might be my plan.
So it's probably your plan. But I can help you with that. Okay? Yes, sir.
I was going to ask the same question. You said preliminary or whatever that was called versus generic. And
Name?
yeah, well, the stages you were talking about, that term you was using, preliminary, what was it called?
Tiers?
Yeah, but then
Formulary?
yeah, maybe that was it.
Okay.
And I was just trying to see the relationship to like generic meds, because sometimes I notice I go to a doctor and they're going to prescribe a generic med, and I'm like, why am I getting generic? Can I not just get?
The brand?
Yeah. And then you're saying there's two
You're-
that must be covered.
So the answer is no. Your insurance is going to say no most of the time.
No to what?
No, because there's a generic available.
So they're gonna always go.
So if you choose to get the brand name of that version of medication, your insurance can either say, okay, but we're going to charge you more, or they will just say no. Okay? Good question. Okay. Did you have a question?
No, I was just telling James that question.
Okay. Okay.
Now, I know that insurance is a business, and pharmacies work along with insurance companies and doctors. In that scenario she was talking about, say there isn't a generic, this medication is very expensive. Now, you said the insurance company will decide what tier they're going to put that in. Generally, do you see them put it in a higher tier to cover their costs instead of putting it in a lower tier for the customer to save money?
Of course. Of course. The medication is brand name. It's brand new. It's going to be expensive. So they're going to charge a very high amount of a copay for that. Yeah. Yes. That is the answer.
Mine is not so much the drug cost or whatever, but what about when y'all call on the phone? Like, you know, what you do when you call, trying to get somebody, when you try to get somebody on, like a Advantage plan or a supplement plan, they tell you that, well, they told me that I had the highest Medicaid, Medicare it was. Then they sent me a note saying that you have the wrong Medicaid because you can't get on this plan because the food card is $250, $260.
Okay, let's start fresh. You said Medicaid.
Medicaid and Medicare.
Okay, so let's delve into that. That's a very, very, very good question. There has been a lot of changes in Medicaid this year. A lot of people are counting, a lot of insurance companies are counting the benefits you receive from Medicaid as part of your income. So the food card, they're counting that as part of income, where they have not historically done that before. I know. So when you are on Medicaid and then you turn 65, you are what we call dual eligible. You're eligible for both Medicaid and Medicare, okay? Those plans change a lot because they're really trying to help, but it can be very confusing, okay? Because once you turn 65 and now you're in that, Medicare is the primary payer. So stuff that Medicaid was saying, they don't know because it was Medicare is now in charge. So it's just, they're not as, unless you have a dual eligible Advantage plan, they're not as seamless like they probably should during that transition. You have a dual one now. How was that transition? Okay, and a lot of those benefits are going down. So the ones that they promised you, they probably changed and they're not what they used to be. So it depends on where you got the information from. People are used to saying, oh, you'll get this and you'll get that and you're eligible for this and you're eligible for that, whereas you're not no more. Oh, the phone people. Oh, the phone people. Let's talk about the phone people. Yeah. Yeah, I can tell you exactly what happened. Okay, hold on one second, because I want to look everybody in the eye. On the commercials, they reel you in with those extra benefits. The food card was one of those circles on that flyer. And when you say the magic word of Medicaid, the phone insurance agent will automatically put you in a plan where you get that. However, once Medicaid and Medicare have had the chance to talk and share information, they see you're really not eligible for that, and they decrease your support. This is because, how do I put this? On the end of those commercials, they will say, call to see if you qualify. Hardly nobody qualifies for the things that they're talking about. Nobody qualifies for those, okay? But they have to put that in the font. Call to see if you qualify. If you don't qualify, they'll probably put you in something similar to what you've already been on, just with a different company, so they can get a commission check. Okay? But if you say Medicaid, all they see is dollar signs. They're going to promise you the world. Because honestly, those plans are amazing. They offer so much assistance. But not everybody is at the level of income need, because there's different levels of Medicaid. But if you just say Medicaid, they're going to sign you up for the lowest Medicaid, but once you actually get them talking, those two agencies finally talking, they realize, oh, you're just in the middle Medicaid. So they take away those benefits. That's what happened, okay? One of the things you have to understand is the commercials will advertise very confusingly to get you to call, to get you to switch from what you're already on. So you have to be confident and know what you have, because the commercials are very confusing. So you just have to understand and know what you have. That's number one. Number two, what was I gonna say? I think I was gonna say something to the effect of, these entities are slow. So we're talking about Medicaid, we're talking about Medicare, we're talking about CMS, we're talking about SSA. They're slow. By the time they finally talk to each other, they realized that you weren't eligible the way they thought you were eligible. But it took them, 2, 3, maybe even 4 or 5 months to figure that out before they decreased your benefits? Is that maybe right? A couple months? Ma'am? Yeah, it takes them. Yeah, so every year you have to reapply for Medicaid, and your situation may have increased or decreased. By the time they figured that out, that's when they decreased your benefits. These companies and these entities are very slow. So when we have to interact with them, we have to make sure our information is correct the first time, because it may take you 3 months to fix a mistake. So make sure your information is correct the first time, and then give yourself that time to understand, learn, and make the decision. Because if you change your mind, it's slow to turn that ship, okay? Appeal, and those are slow too. Yeah, you can. Most of the time, yes, they are supposed to, yes. But I haven't seen them completely been always right, because by the time they got the paperwork, it was a month later, you know, it's, yeah. Okay, okay. No, there is an end plan, you just don't. Oh, so sorry. So Ms. Wanda asked, she heard that there was an N plan with supplements. Yes, there is an N plan. The letter N as in Nancy. It's not as good as a G. So I don't sign people up for N's. Are you on an N? Okay, good.
So you think G is the best out of all of them?
It's the best if you are turning 65 now. Okay.
My question is, you made a comment that sometimes pharmacies may be out of the network. How do you know if the pharmacy is out of network versus the cost of your medication may increase? And the second question is, can you switch pharmacies at any time, or do you have to wait until your enrollment?
Okay. So your first question was, how do I know if my pharmacy is in network? So once you have your prescription drug plan card, you can call member benefits and find out your in-network pharmacies or preferred pharmacies. They're called preferred. Or you can ask your friendly insurance agent like myself. Or you can go to one of the free services for Medicare that are offered in town, like SWRCA. They will be able to help you. And then, yes, you can switch pharmacies at any time. We do it all day, every day. It does not hurt our feelings. It is getting easier to do, but of course, the more medications you have, the harder it is. And you have to have refills on your prescriptions for us to transfer them. If you have 0 refills left, there's nothing for me to transfer. So you have to go to your doctor to send the prescriptions over to the pharmacy of your choice.
This might be outside of your wheelhouse, Social Security. If you're a certain age and you start wanting to get drawn down, but you're still working, like as a consultant. Yeah. Is there a limitation, and how much, where does that fall? Where does that land?
That is outside my wheelhouse. I don't know. Yep. Listen, socialsecurity.gov will be your source of where to ask that question. Okay? I'll tell you if I don't know, and that I don't know. Okay, next slide. Okay, so many options, which one to choose. Okay, something new that happened in 2025 was the prescription payment plan, the PPP, the new PPP, right? So this is drug layaway, okay? People had really high deductibles in January where the prescriptions were $590. How can I afford that? So you can actually sign up with your drug plan to be on prescription layaway, okay? The confusing thing about this is usually with layaway, you go buy your item and you have a set payment until it's paid off. But sometimes you can add to it. Oh, add this to the layaway too. So every time you go to the pharmacy to pick up more prescriptions, you're adding to that layaway cost. So your cost will eventually go up as well, okay? So this is not a prescription savings plan. This is just gonna even out your payments, okay? Now you can jump into and jump out of this program at any time through your insurance company, and it starts over December 31st. However, do not think, oh, January I got a high deductible of $600, I'm gonna sign up for the PPP, then in February, I'm gonna change it back. You still owe that money, okay? That bill will still come, okay? So you have to understand that this is not a savings. You can't cheat this system. They have thought it out for you, okay? Okay, so this is just a way for you to even out your payments throughout the year. but your payments will grow as you continue to go to the pharmacy to pick up more prescriptions. Okay? So don't say in July, oh, last month my bill was $50 and now it's $60. Well, you picked up more prescriptions. So it's going to add to that. Does that make sense? Because I think that was a confusing pain point for a lot of pharmacist friends of mine this year. Yes, ma'am. Yes, ma'am. So what will happen is when you go to the pharmacy and you've enrolled in the PPP, you don't pay anything at the pharmacy. You will get a bill in the mail from your insurance company, and that is how you pay for your prescriptions. And they will calculate what your payments will be every month until the end of the year. And then in February, you pick up more. Well, those copays are still zero at the pharmacy, but you still have to pay for them, so they will add that to the rest. There's no more donut hole. This is not the donut hole. That is, it used to be in 2024, but since it's old, I ain't gonna go over it because it's confusing. But there's no more donut hole. So this is just a prescription layaway, but you're getting your prescriptions every single month. And as you get them every single month, it's adding to the cost of what that amount will be. So it's not a savings program, it's just evening out your payments. Now, as your friendly pharmacist, just because you think it's free at the pharmacy, don't go say, fill everything, everything's free. You still gonna pay for it. So if you got a whole bottle in July that you haven't opened from February, use that medicine first before you go to the pharmacy and just say, fill everything. And if you tell me to fill everything, I'm gonna say, no, you tell me what you need. Because people have hundreds of bottles of things that were free, and then they're confused, and they don't know what to take, or they take the wrong thing, or they take it twice. So we're gonna just fill what you need. Don't get all excited you think it's free, because you're paying for it. You're paying for it, okay? Next slide. Okay, in 2026, there has been some decreases in medications that are brand name. These 10 are the first 10 where the medication costs on Medicare plans will decrease. Okay, I'm gonna just run through them real quick because I know it's kind of hard to see. If you're on these, you'll recognize it. Your copays should hopefully be less in 2026. So we've got Eliquis, Enbrel, Stelara, Entresto, Imbruvia, Novolog, also called Fiasp, Xarelto, Januvia, Farxiga, and Jardiance. Hopefully, they'll add more to this list, but for 2026, these are the first 10, or maybe the only 10, I don't know. Okay? Next slide. All right, so we've talked about all these sections. Okay? Next slide, we are going to go over, next. Enrollment situation. So this is the last box, so we're almost there. This is the last box on your notes section, okay? Next slide. Can I have Part A and not Part B? The answer is yes, especially if you are still working, you still get your health insurance. However, it is very important for you 3 months before you decide to retire. 3 months before you decide to retire. You will come to me and I will give you CMS Form 40B, okay? And then you'll complete the top, your employer will complete the bottom, and then you can sign up for Part B without having a penalty for not joining Part B when you first became eligible when you could have joined. Okay, so this will make sure you don't have a penalty. If you can help it, please do not spontaneously retire. Say, I'm quit out, I got Medicare A, I'm out of here. No. I've had bad phone calls, okay? Medicare is slow. You won't automatically get it the next week, okay? And you don't want to be on original Medicare or just A. and not have B, okay? I've seen it. Don't do it if you can help it. Sometimes people lay people off and you can't help it. I understand. But if you can help it, don't spontaneously retire. Give yourself 3 months to start getting things in order, okay? Next slide. All right. Insurance works when everybody's putting money into the pot. Medicare is the same way. So if you had the chance to join Medicare and you decided not to because, oh, I don't take no prescriptions, or, oh, I only go to the doctor once a year, and you don't sign up for B, you don't sign up for your drug plan, you don't sign up for Advantage plan, and then 10 years later you decide, oh, I'm getting sicker, let me go ahead and then sign up, you will have a late enrollment. And Medicare will be Kermit here, sipping tea like, back then they didn't want me, but I'm gonna get them now with this penalty. Because that penalty is every single month until you die. Okay? So, this penalty is enforced on Part A. Most people, if you've worked for 10 years, you don't have to pay for Part A, so that's really not an issue. But it will be on Part B and Part D. So you have double penalties, okay? Next slide. We want you to enroll in Medicare with no late penalties, also no coverage gaps, okay? There are situations where you waited too late or you didn't know and now you want to sign up, but you've got 2 or 3 months without health insurance. We don't want that either, okay? We want a smooth transition. Next slide. So don't jump into the Medicare waters alone, and educate yourself and give yourself time to learn, and give these entities that we're talking about plenty of time. So we're talking about CMS, we're talking about SSA, we're talking about your HR department at your job. All of these have to time together to get everything to be smooth for you, okay? So make sure you contact a professional, okay? Because we want to, you see how this lady's stepping off the boat? We want you to step onto the boat of Medicare dry, no falling into the water, okay? Even if you have a life jacket, they're like, oh, well, I got some, my cousin is, okay, but make sure you got somebody that will help you, okay? All right, next slide. So there are situations where you get a special enrollment period. This is a lot on this slide. All I want you to look at is the yellows. Loss of coverage. There's been a lot of loss in Medicaid, so you're eligible for a special enrollment period. There's been a lot of layoffs from your employers, so you're eligible for a special enrollment period. People have been relocating, or they have just decided to retire when they were going to retire. So that allows you that special enrollment period, okay? So if you apply for any parts of Medicare within the special enrollment period, you don't have a penalty. There's lots of situations and innuendos, but make sure you know about these options so that you can plan accordingly. Okay, next slide. Okay, if you have an HSA plan from your employer, once you turn 65, you are no longer allowed to contribute to it, so make sure you stop that the month you turn 65. There's not a lot of people in that situation, but nobody knows that, so just make sure you do that, okay? Next slide. So summary. So we've talked about cost changes, premium changes, deductible changes, maximum out-of-pocket changes, increase of costs of services, decreases of opportunity of services, decreases of benefits, changes in networks are happening a lot. There's lots more people getting Medicaid eligibility withdrawn. But there's also a lot of age changes going on for the agents, as myself. So there's actually a big decrease in commissions this year. So be leery of people, insurance agents, trying to sell you something else. okay? They're gonna wanna try to sell you something else to make up for the lost commission they're getting from helping you. Also, where you used to go for your free look, for your free review of Medicare, it's gonna be hard to get an appointment because those places are gonna be booked up because the people they used to go to, their agents, will no longer see them, okay? Overall, more is gonna be expected of you, okay? So I'm still seeing all my people, even though I'm not getting paid, but you have homework to do before you can make your appointment with me. And it needs to be done so that our time together is useful. Because if you are gonna stick with the same plan, we don't need to meet, right? So, if I'm your agent, you will get some homework, but I'm still here to help you. Okay, next slide. One of the things that's important to know is Medicare sends out information. One of the pieces of information you have to keep aware of September's and October's. During September and October, is the annual notice of change form. We call that the ANOC. That is from your insurance company. It is telling you what your plan is going to be in 2026 if you stay on it. It's going to tell you the increases, the decreases, all those changes side by side in a form. Look for that form and look at that form. Better yet, if we meet, bring that form to the meeting, okay? It's called the ANOC. Also, whenever you meet with an agent, you'll have to sign a scope of appointment form. This is for your protection. This is a form that says, in our meeting, we're gonna be talking about these things in Medicare and nothing else. We're not allowed to talk about anything you don't check in that box. Not annuities, not life insurance, not indemnity plans, just those things. And this is for your protection, so you don't get reeled in for one thing and then duped into buying something else, okay? But luckily for you, I really don't sell anything else, so probably should, but I don't. Okay, once you sign up for a plan, you will get a summary of benefits form that will summarize your benefits, and then you'll get an evidence of coverage, which usually has your card, if you get a new card. And then every single month from that plan, you'll get an EOB, or explanation of benefits. Have you guys seen an EOB every month coming in? Yes, you have. See, these are the forms we're talking about. Okay, next slide. Okay, if you are not an agent of mine, and you want to be, you have a business reply card that I need you to fill out and give to me after this meeting, okay? I am not allowed to cold call, or my cousin said to call her. I either have to have them call me or your permission for me to contact you on that card, okay? Next slide. All right, if you are my client, go to my website and book your appointment. Like I said, I'm getting booked up, so book your appointment now. Now, I can meet with you October 1st, but I can't enroll you in anything until October 15th. So if my books get full October 15th after, I may have to open up October 1st through 15th, but I can't enroll you. We'll just talk about what we could do and write it down and do it later, but I can't do that, okay? So if you are my client, you know my website, go make your appointment. Yes, sir, SeniorShieldHealthInsurance.org. Okay. Next slide. Okay, if you have personal, specific questions that you want to ask me that you don't want to ask here, you can send them to SeniorShieldHealthInsurance@gmail.com. My website is SeniorShieldHealthInsurance.com. And now I'm going to open up for any questions. Any questions?
I have an Advantage plan right now, and I get my prescriptions usually through CVS or either their center point through the mail. My question is, they're always trying to get me to get my prescription with them versus with CVS. But if I get it through CVS, they still are paying for it. But my pills look different when I get them through CVS versus when I get them through them. But I guess I am still getting the same product, but they do look so much different. What's that all about?
All right, very good question. So different pharmacies use different manufacturers for their medications, or they have contracts with different suppliers. So if you get your prescriptions and it looks different than before, honestly, I hate to say this, type the description in Google. It'll actually tell you what that tablet is. Now, if it doesn't match what's on your label, warning, right? We made a mistake somewhere, somehow. We're not robots. It has happened, okay? But if you get your prescriptions from mail order pharmacy, they have a different supplier than the CVS, okay? Even if you go across the street to Walgreens, they also have a different supplier or a different manufacturer that they use. And even if you stick with CVS, the next month it may not look the same either. So there have been situations where I have 5 tablets of 17 different atorvastatin, 5 milligrams on the shelf because we have switched back and forth because CVS is trying to get it cheaper. It's annoying. Type the description of your medication in Google and make sure it matches what's on your label. It's not required. CVS does it. Walgreens does not. I haven't looked at Costco's label. It's not required, but CVS, as of 2 weeks ago, does. Some of the mail orders will, but it's very small to see. It'll say this is a yellow round tablet with a 4 and a 2T, and it's super small. Because we're running out of space on the labels, right? We just can't fit everything. But it's not mandatory for them to have the description on the label in the United States or in Indiana right now. But some pharmacies choose to do it. Okay?
So on your birthday rule,
Yes, sir.
like say 2026, regardless of your condition or your medication,
Yes.
you can switch your plan,
Your supplement.
your supplement.
Yes, sir.
And basically, you're going to pay the premium according to your age at that time.
Yes, sir.
Okay. But they cannot use any medical information for underwriting.
They are not allowed to use that to deny you care. Or it's called guarantee renewable. So they will give it to you every year after that. But yeah, they cannot deny you.
Right, or they can't surcharge because of a pre-existing condition.
Now the surcharge, I don't know about. I don't know that the answer. Yeah, because there's different levels. You'll have either preferred or standard levels of like your G plan. Different insurance companies will say, oh, it used to be non-smoking, but now it's height and weight or medical history. So it just depends. I don't know the answer to that question yet.
Okay.
I will try to find it out soon and let you know. Okay. All right. Well, if there's no other questions, this has been a very long presentation, so I appreciate you all hanging in there with me. All right. So thank you so much for your attention and your time and your questions. I really do appreciate it. Yeah, have a wonderful day.